Let's now talk to the OCTA Research Group. Joining us live via Zoom is research fellow Dr. Guido. Good morning, Professor David. Thank you, as always, for joining us. Now, the health department says there's still no indication of a surge. Do you agree with this, or are you still predicting what you call a weak surge?
Well, I think, Ria, that would depend on how one uses the definition of a surge. Now, of course, the health department, the Department of Health is the official body of the government. That being said, we are definitely seeing an increase in cases in COVID-19. The 7-day average in the country has now increased to 437 from 240 last week. So that's an 82% one-week growth rate. And in the NCR, it has increased from 115 to 212. So we're now averaging 212. That's also an 84% increase. And if this continues, we'll definitely be seeing higher numbers over the coming few weeks. The reproduction number in NCR is all the way up to 2. Again, it depends on how one defines surge. But this is definitely an increase in cases. Personally, I might even call this already a weak surge.
All right. So you mentioned the reproduction rate for Metro Manila. What is it nationwide?
Well, nationwide, the reproduction number is 1.80. So it's almost 2. So that means there are now 2 infections happening for each person who has the virus in Metro Manila. And nationwide, almost 2.
All right. That being the case, what do you expect the numbers to look like by the end of this week? How many cases a day or a week are we looking at?
Right. By the end of this week, unless something causes a reversal in the trend, we could be seeing about 400 cases already in Metro Manila by the end of this week. And in the whole country, around double that, around 800. It could even go up to 1,000 cases per day. In about a week's time.
All right. You mentioned that this already looks like a weak surge, and you mentioned it depends how you define that. For you, Professor, how would you define a weak surge, at least in terms of the numbers?
We're not calling this a surge, but a weak surge would be an increase in cases that is more significant than, let's say, an uptick in cases. We were seeing upticks, several weeks ago. And again, of course, we're still monitoring the hospitalizations, and they're still low, and the number of severe cases is still low. But the number of infections definitely increasing, and we could be up to, like I mentioned, almost 1,000 cases by this time next week. And I think that already would classify it in the weak surge category.
All right, Professor, we're under alert level 1 until the end of the month. At what point do you feel we should raise the alert level? Because as we know, you need to look at a lot of factors. It's just not the increase in the number of cases, but you're also looking at the severity of these cases and healthcare utilization rates, right?
Right, Ria. At this time, there's no cause for alarm to increase the alert levels. We are probably going to be staying at alert level 1, most likely. Of course, the alert level classification is decided by the Department of Health and the Interagency Task Force. So, we could be seeing alert level 1 unless there's an increase in the number of hospitalizations. I'm not sure what the cutoff for the Department of Health is. I think, if hospitalizations increase around 50%, there might be at least a discussion about changing alert levels. Right now, hospital utilization in NCR is still very low at around 22%.
All right. Professor, always good to talk to you here on New Day. Thank you very much. That was OCTA Research Fellow Dr. Guido.